Hey everybody, it's the last Sunday of the month, so welcome to our monthly Sipping My Tea. I was reminded, those of you who don't know, we started Sipping My Tea in 2019 during the COVID pandemic. I was in Sacramento. Remember, I was in the state legislature at the time. I stayed in Sacramento because as chair of the budget committee, we were still working collaboratively with the governor to try to get resources to people. And so we started Sipping My Tea on Sunday evenings to try to share updates and information with people who needed it. Because the situation was so dynamic, it was changing day by day. And I feel like I've returned to that time. So I'm glad that we have jump-started Sipping My Tea again, because today is going to be a very special show. I've got a couple of guests. I am sipping. But we are about spilling the tea today and mainly trying to make sure you have accurate information and information about necessary resources that too many Angelenos are going to need. We're talking about the federal government shutdown. We're going to talk about two things because they're having kind of an overlapping impact on LA County and some of the life-saving programs that we administer for the federal government. So first is the federal government shutdown, where I've lost track. We're in day like 24 or something. And it's also something called HR1, which was a bill passed by Congress that is changing significantly some of the programs that many of my constituents and many of us rely on: CalWorks and Medi-Cal and subsidized childcare. And so that's what we're going to be talking about today. And the point of talking about it is to really make sure you have accurate, timely information. And most importantly, from my perspective, you know what resources are available to help you in the interim, in the meantime, here in LA County. So that's what we're going to spend our time on today. And I'm really deeply proud that I've got some of my LA County family who are experts in these areas are going to be here to share. So with regard to the federal shutdown, I'm sure you've seen it on the news. Congress has gone home. They can agree. Frankly, the Republicans and Democrats can agree on what it will take to keep the federal government going. They can agree on some budget items to keep the federal government going. So let me start with what is not impacted, so we're clear. What is not impacted by the federal shutdown is CalWorks, General Relief, Medi-Cal, IHSS, in-home supportive services, and most subsidized child care programs. So these programs are going to continue to operate as normal and are not impacted by the federal government shutdown yet at this point. So that's the good news, what we know so far. What is impacted and will devastate us is CalFresh. And so the CalFresh benefits will be delayed for the month of November, again, due to the federal government shutdown. Y'all see the calendar. November 1st is coming up this week. So CalFresh is the only program that will be impacted, but it's a vital program. 1.5 million people in LA County rely on CalFresh, the SNAP program, for groceries every day. The district I represent, the 2nd District, we have over 390,000 children and adults who receive CalFresh. I represent the most people in the county who are dependent on CalFresh for food. And so why is this happening? First of all, it angers me deeply because it's a choice. It's not because we're in a recession and the federal government doesn't have the money. They are choosing to spend it differently. We saw that in HR1. The Democrats, frankly, aren't willing to pass a spending plan if it doesn't include help for the Affordable Care Act. Subsidies for the Affordable Care Act. So they're at an impasse. They're fighting. I appreciate they're fighting for a good reason, because 850,000 of my constituents are Medi-Cal recipients, so we need that help. But in the meantime, with the federal government shutdown, CalFresh is stalled effective November 1st. So again, 30% of LA County's recipients are children under the age of 18. And it's going to disproportionately impact my Black and Latino constituents. And also it's going to have a devastating impact on small business. The CalFresh budget amount for LA County alone is over $320 million per month. So that not only supports these children and families afford food, but it also supports our small grocers, small businesses, places we can go and use our CalFresh dollars. And so when I think of all of the small grocers, the farmers markets where we have worked so hard over the years to allow you to use your CalFresh benefits, you know, the new programs at the state where you get more bang for your buck if you go to a farmers market, the great farmers market that is operated in my district out of Compton Community College. So again, it's horrific. So the question is, what do we do about it? This is going to be a stressful time. We are looking for partners across the board to figure out ways in which we can help close the gap. I was so heartened. I visited a number of churches today in the 2nd District, and Bishop Fisher at Greater Zion Missionary Baptist Church took it upon himself, acknowledging that he had church members who were going to be impacted, called them out, told them to come to the front, and made a commitment from the church that the church is going to support them with a dollar amount monthly until this is resolved. It was so emotional, and it filled my heart to know that community will and must step up. And so philanthropy, individuals, churches, everyone, I hope, is going to step up to the place like the county is going to do to try to help people. So let me introduce you to two true experts in this. I want to thank them for their years of service to the county, all they do working at the county's Department of Public Social Services. And that's Sean. I asked you how to pronounce it, and then I lost it. Emil. Sean Emil and Angelica Minton. Thank you both so much for taking some time out on your Sunday evening to really try to help us make sense of it all. I appreciate the work you do, because you all are the front line. You all know better than I that the county is the safety net level of government. And when people go to DPSS, that is the literal safety net. You are helping families keep it together when they need government support the most. So I really appreciate you both. Tell me what you both do at DPSS so we can understand the role you play.
Great. So I'll start and I'll hand it over to Angelica. So I oversee the General Relief and CalFresh Program Division at DPSS, in which we oversee the policy and procedural processes that we have for our CalFresh program, for our General Relief program, for our CAPI program, and for our START program, which is a welfare to work program for our General Relief participants, as well as our employment and training program for CalFresh. Angelica?
Beautiful.
Thank you, Sean. I am actually with the Medi-Cal program and policy section, and I help oversee how the state and federal healthcare policies are implemented at the local level, and that our staff have the tools that they need to serve the community. Our goal is to help residents access and maintain healthcare coverage, and really to support the overall well-being of our communities.
I appreciate that. So Sean, we're going to start with you because CalFresh is front and center. I'll move on over to Angelica because, Medi-Cal also will be impacted because of HR 1, but that's not for me as pressing right now.
Correct.
So, Sean, how is it being impacted currently? I think I gave the high level, like November 1, there will be no resources uploaded to your EBT card. I think that's the short version. Can you explain it a little more in depth for people?
Absolutely, Supervisor Mitchell. So with the federal government shutdown, what it does is that basically for one of the programs that's impacted, CalFresh, nationally known as SNAP, we receive as a state the allocation for benefits on a monthly basis for CalFresh. So the feds push over the money to the state, and through our CalSAWS automated statewide system, it gets dispersed to our recipients. And then our applicants, we actually release those fundings. And unfortunately, as you have mentioned, because of this government shutdown, the allocation for CalFresh benefits for the month of November are not there. So we had to have received them by Friday, which was the 24th, to allow us to be able in the system to have these released to people on time. So unfortunately, as you mentioned, our November benefits will be delayed. And unfortunately, we at this time don't know for how long.
So I forgot at the top of the show to ask people to reshare. We want to make sure that you reshare this in your to your own networks and social media so we can spread this information as quickly as possible. I also, Sean, thank you. When you hear SNAP on the news, understand that for California and LA County, it's CalFresh. So people say, oh, I'm on CalFresh, not SNAP. It's the same thing. That's just like Medicaid at the federal level. In California, we call it Medi-Cal. So it's the same program. So if you hear SNAP, understand if you're a CalFresh recipient, that's you. So Sean, the money comes from the federal government down to county recipients. It's not county dollars. Friday was the deadline for them to be able to literally, the process to upload on the EBT cards, the millions of people. Again, 1.5 million in LA County alone. I think it's something like 42, 43 million nationwide. So you can't just like flip a light switch. Oh, they passed the bill, we can flip it back on. Do you have any idea like how long it would take if by some modern miracle, say Tuesday or Wednesday, they get their act together in DC? How long would it take for CalFresh recipients to expect to be able to get their resources?
I think that's still a discussion that it's being had by the state. And just so you know, the contractor or the agency that actually manages the electronic benefits card, right? Everybody knows of an EBT card. That contract is actually managed by the federal government and the state. So one thing that has been asked is for them to really consider, look at your process and cut down any unneeded steps so that when the funding is available, it gets distributed immediately or as quickly as possible. We all know those that are receiving CalFresh, you usually get your benefits from the 1st to the 10th of the month, and that would be adjusted. So I do believe that there has been discussions at the state to kind of do it on a rolling basis when we are getting the money. So those that would get it from the 1st to get those 1st and 2nd and so on.
Got it.
They haven't given us, unfortunately, a timeline, but I do know that they have determined that they will want to do this expeditiously with knowing the importance of how this is impacting California.
Right. Well, please know that we are in conversation with our congressional representatives. The California congressional delegation is get it. They're on it. LA County is communicating with them. So LA County delegation reps are clear about the numbers and how their constituents are being impacted. So that's really important. And I think it's also important, Sean, to say for people who receive CalFresh to pay attention. If you get text messages from DPSS, if there's a renewal, don't just say, oh, they don't have a budget, the federal, government, I don't have to respond. No, we need you to stay on top of your game. So when the money begins to roll out, there's no bureaucratic hiccup that impacts your ability.
Absolutely. Absolutely. Because we want recipients to get, as we said, your benefits as quickly as possible. And even though you know that the federal government shut down, if you know people that might be eligible for CalFresh, please have them apply. This does not create a barrier for your application. It just creates a barrier for when do you receive those benefits. So our DPSS offices are open. We are not closed. we are, as you mentioned, Supervisor Mitchell, are communicating, and it might be as we continue this conversation, there's going to be a lot of information that's coming down because there are a lot of changes. But one thing that our department is committed to is trying to communicate this change and these various changes as much as possible so people are informed. So don't hesitate, as we saw on the screen, to give us a call at our call centers, or if you need to come into the office to ask. Unfortunately, like I said, these benefits are not there, but anything that we can do to make sure that that process is as clean, as streamlined as possible for you to kind of receive your benefits, we want to be able to do that. So if you have a semi-annual reporting report or SAR-7, please submit that. If you have your annual recertification report, please submit that. Those things will continue with your case. We do not want cases to get terminated for bureaucratic reasons, as you mentioned, in this time when it doesn't necessarily have to.
So how can people who need support access food resources? I know you guys are doing free virtual webinars to help residents be informed and be prepared. I appreciate that. Keep them going. And we want to make sure that people know how to find out. You don't have to wait for Sippin' My Tea. This is only once a month. DPSS is doing virtual webinars that you've already started. So how can residents who need support access food resources?
So in partnership with the Poverty Alleviation Initiative, and we're working with our LA food banks, one of the things we're really asking is, please make sure you're making your purchases with your existing benefits, however you see fit, and additional resources such as the food bank. So if you go to lafoodbank.org /find-food, there's going to be a map that you can actually find your closest food pantry and closest food banks. Please make sure you're seeing what those at. Our 211 is actually also assisting in coordinating and guiding people to the appropriate places. We've been in active discussions with food banks and with our grocers to really consider increasing their donations during this period, as well as reaching out to our philanthropic partners and saying, please consider this. So people are on alert. We've alerted them that there might be an increase in need. So these resources are out there. Please use them. That's what they're there for.
Beautiful. So we're going to make sure, put that slide back up, please, Lene, that people see that code where you can find one of the 900 food bank sites across LA County. I saw in the news images that the governor sent the National Guard to the food banks to help boost our volunteer personnel numbers to bag food. The county has put money in. The state has sent money to all the counties, including LA County as the largest county in the state, to make sure we have resources. We talked about it in board meeting last Tuesday. I think it was something in the area of $10 million that the county has put in. So, I'm clear that this won't replace your CalFresh benefits, but it is an emergency step that we have taken to try to make sure that people don't go hungry, to be perfectly frank. And so there's a number where you can call. You can call 211. They're always a great resource. But there's the code, the barcode, where you can link and see. There are a couple of questions here. Will EBT cards be shut off on November 1st, or will they still be able to use them? I guess they mean if they still have money left on them from the previous month.
No, that's a great question, Supervisor Mitchell. So far, the state had said that participants, recipients of CalFresh, will still be able to use their cards in November. But one thing I will say, we keep on getting information flowing from the state. So please take a look at our websites. Please look, as you mentioned, text campaigns. LA County has been doing that to notify. The state is also doing text campaign and email. And I really wanted to emphasize that because, as I mentioned, things are going to be constantly flowing and changing. So we want to keep you up to date. But as of the most recent information, EBT cards will still be able to be used for benefits that might have been received in October or prior. Some people don't, use all their benefits from the month.
Mm-hmm. Another question. Hey, Franco Vega, he's asking about his foster youth and wants to know, is there going to be a backup plan for his foster youth at EBT? And so, Franco, when we talk about backup plans, the LA County SNAP allotment per month is $320 million. So the county nor the state has $320 million to backfill for the federal government. We just don't. Our budgets aren't that large. And so is there a backup plan for particular subpopulations that are, particularly at risk? Foster youth, former foster youth, transition age youth are a perfect example.
So hi, Franco. Good to see you. So one of the things that I know that we are working in collaboration with our various sister departments is those looking at to assist these, most vulnerable populations. There's not, a hierarchy of one over the other. Everybody is receiving CalFresh, but I know that there are some efforts to take a look at what additional assistance can be made. So I don't have anything concrete right now, but I do want to let you know that there are, our partners are looking at these specific pocket organizations and see what additional assistance can be made.
Okay, so again, stay tuned. So, Angelica, we're going to transition now from the federal government shutdown, as if that isn't bad news enough, to now HR 1, the big, bad, ridiculous bill. And I say that because, to cut $1 trillion from Medi-Cal, it'd be one thing if the federal government didn't have the $1 trillion. They've made a decision to cut it. So talk to us about what happens. There's new work requirements for Medi-Cal, some other new requirements for CalFresh that will go into effect in January. So can you give us a little highlight on what those policy changes are and what people can expect?
Definitely. Thank you for the question, Supervisor Mitchell. But right before I get into the HR 1, I'd like to just touch on the state policy changes that came into play with fiscal year 2025 through 26, which is the budget. Now, these are the changes that are taking place effective January 1st, 2026. After this, I will pass it on to Sean in case there are any updates for CalFresh. So for the Medi-Cal changes, like I said, these are starting January 1st, 2026. These will be the asset limit reinstatement, the Medi-Cal enrollment freeze. Later on in the year, effective July 1st, 2026, they will be eliminating dental benefits for this population. And then starting July 1st of 2027, a $30 premium will be implemented for this population, which is the Medi-Cal enrollment freeze. These are the changes that are coming up in January. Then we still have additional changes, which are part of the HR 1 that are impacting.
Okay, but before you go into HR 1, let's just break this down a little bit. And you saw my reaction because when I was first elected to the legislature in 2010, they had eliminated Dental Cal as a cost-saving measure. And it took us years to stand their program back up. And, Dental Cal is a critical element as we talk about the impact it can have on your physical health. And we're asking people to get jobs and so dental health is meaningful. You talk about asset. I just want to make sure people understand that when we talk about assets, we're talking about assets like the value of a car, a home. I worked hard when I was in the legislature to relieve some of those asset tests, just to relieve some pressure on people. Very rarely, unfortunately, do people all of a sudden from one month to the next earn so much income that they don't qualify for these poverty alleviation programs. But what happens is we have these little, ridiculous checks and balances that people end up disqualified. And it's not because they're earning more. It's because, their 5-year-old car is the blue book value we think makes them ineligible for these programs. So when you talk about assets, we're talking about the value of a car. If you own a home, what else constitutes an asset?
So for assets, if it's the primary residence where the individual is living, then that's not counted. We're talking about if they own additional properties.
Okay.
Same thing with the vehicle. If they have more than one vehicle, we do use the blue book value, right? And, we take into consideration anything after the second vehicle.
Okay.
Okay. It's also bank accounts, trust accounts, annuities. So those are the types of property that will have to be reported. Now, this is affecting primarily our seniors, age 65 and older, disabled, and those that are in need of long-term care. So the property asset is being reinstated for those for those individuals.
So that means, we have, I have a disabled family member who may have a home, may have inherited it from their parent. You know, you're a parent of a disabled adult. You want to make sure that they're taken care of when you're gone and you leave a home to them. So the value of that home could potentially disqualify them. Doesn't matter how much money they earn on SSI or whatever. It could disqualify them from in-home support services work.
Well, as long as the disabled individual's living in the home,
okay,
then it won't be counted against them.
Okay, great. All right. Okay, I'm feeling a little better. This isn't quite going back to the late 2008, 9, 10.
No,
In a deep recession.
Yes.
And the way we
Yes.
saved money was by limiting eligibility, and it hurt people. So I feel a little better about these things, except we have to make sure people understand and know. I'm deeply concerned because I know the enrollment numbers in Medi-Cal in the 2nd District are going down, and we don't want people to not enroll. And I know, given what's happening with the federal government and the ICE raids, that people are afraid. I understand that. But I also don't want people who are eligible for Medi-Cal to not enroll. So could you talk about that a little bit?
Absolutely. That's correct. We want people to continue to enroll for Medi-Cal regardless of their immigration status. And we're asking that any LA County resident, please enroll for Medi-Cal by December 31st, 2025. Especially if you fall under that unsatisfactory immigration status. If you apply by December 31st of 2025, you will still be evaluated for full scope benefits. This will affect those that apply effective January 1st of 2026. Okay. Anybody who applies after January 1st, then you will only be evaluated for restricted Medi-Cal, which covers emergency and pregnancy services only. So as long as you apply before then you will still be evaluated for the full scope, and you'll keep those benefits until you lose dental effective July 1st of 2026.
And let me just be clear, because I think people sometimes get confused based on the rhetoric we hear coming out of Washington, D.C. Federal dollars cannot be used for people who are not citizens. They just can't. The state of California, given our population and the demographics of our population, have chosen to expand Medi-Cal to all of those who are income eligible, regardless of immigration status. And that's based on kind of our values as a state and based on the reality of our population. When we look at counties like Los Angeles and the significant role my immigrant brothers and sisters play in our economy, the impact they have on our public education system, the role they play in paying taxes as working LA County residents. So we have a lot of hate-based, fear-based rhetoric kind of that surrounds us. And I think it's really important that people look at the facts and understand who qualifies for what benefit, what dollars are used to pay for them, and acknowledge that immigrants are contributing to the economy of LA and this state, and they're not taking from it. I just think that's important to talk about. Okay, we've got a question here. She said, are you saying no dental coverage for Medi-Cal in July 2026?
So in July 2026, the individuals that will be losing their dental coverage are those that are impacted by the expansion enrollment freeze. So it's primarily those with an unsatisfactory immigration status or those that do not meet the 5-year bar if you're a legal permanent resident. But U.S. citizens will continue to receive dental coverage.
Okay. All right. I hope that was clear. You were freezing a little bit, Angelica, but I hope we got the answer. It's okay. We hope we got the answer for May. So you were going to talk a little bit about HR1. Let's touch on that before we talk about when the next webinars are the DPSSS is hosting.
Yeah, so the changes that will be impacting Medi-Cal as part of the HR1 bill are the work requirements, the eligibility determinations, co-payments, retroactive coverage, and immigrant eligibility. Now, most of these changes will be taking place effective January 1st of 2027 and moving forward. I think the last change, it comes in 2028.
Mhm. Okay. Again, I'm asking folks to reshare that this is live, but it will still be up on YouTube and on my Facebook page. So if you reshare, people will be able to see the whole conversation from the beginning. We want them to see the resources, and we'll put them up again before we end. So before we wrap up again, Angelica, Sean, thank you for your time on a Sunday evening. If you could give 2 or 3 points, main takeaways we want people to understand based on what we've shared today, what would they be?
I would just say for CalFresh, please don't hesitate to continue checking the DPSS website for information and things that are changing. So I know we didn't touch up on HR1 changes to CalFresh, but there's a lot of those coming down the line. And that's going to be impacting, unfortunately, our previously eligible non-citizens. Work requirements is coming back in, some changes to deductions. So please, that's all going to be on the DPSS website, and we're going to be doing communication campaigns. We are also going to be mirroring what Medi-Cal is doing with information sessions on these changes as well. So the number one thing is keep on checking our websites. There's going to be a lot of text campaigns. We're trying to get this message out. So please read them. Please check your emails as well.
And I agree, because, on the board of supervisors on Tuesdays, we drill the director of DPSSS, like outreach. How are you talking to people? And you all are using technology, using text technology. You're updating your website, but it's only as good as people are going to choose to use it. And so I think how easy could it be to get a text on your own cell phone? But we do need you all to read it and pay attention. So thank you for that. Angelica, any one or two takeaways you want people to know?
For Medi-Cal, I think it's really important for everybody to just keep that December 31st, 2025 date in mind. If you don't already have health coverage, please, apply for Medi-Cal. You're still going to be evaluated for full scope Medi-Cal. The second thing is, like you just talked about, those webinars. We've already started hosting webinars to discuss the policy changes that are coming. Visit our website, visit the DPSS website, visit the healthcare website. For those of you that follow social media, Facebook, Instagram, we've posted the webinar flyers there. You can, click on the link, scan the QR code, and you can register for one of our webinars. We have a few more coming up all the way through November 6th. And once those are done, in the next coming weeks, we'll be having more webinars to discuss every single major update for the Medi-Cal program.
So please, everybody, if you have a family, friend, or neighbor who is a Medi-Cal recipient, CalFresh, please tell them about the webinars. It is so important that people have information. We will probably, if you ladies will be willing to join me again in the future, let's get through the federal government shutdown and this CalFresh crisis. And as we get closer to implement January and then mid-2026 implementation of the other policy changes to both Medi-Cal and CalFresh, I'd love to have you all back on so we can continue to keep as many people as informed as possible. So thank you so much for joining me on your Sunday evening. I appreciate it.
Thank you, Supervisor.
Thank you, Supervisor Mitchell. We appreciate it.
Thank you. So I'll just want to recap on CalFresh. Want to make sure everybody gets it. At the moment, CalFresh benefits are going to be delayed for the month of November due to the federal government shutdown. What will not be impacted as soon as November is CalWorks, General Relief, Medi-Cal, in-home support services, and most subsidized child care programs. They're continuing to operate as normal. I don't know what we mean by most. I'm not sure which one. So if you have a child care subsidy, you should call your worker or the agency that you get it from. Call my people at Crystal Stairs to make sure that your child care subsidy is still available. Again, CalFresh recipients will receive notification from the state informing you that your November benefits will be delayed. But again, it doesn't mean that your case has been terminated, that you're no longer eligible. That's not it. It just means the money's not coming down from the federal government. So what that means you have to do is to continue to comply with all the reporting requirements, to make sure that you are still eligible for your benefits, when they get their act together in DC and the money becomes available. Again, food resources for the month of November. 940, actually, it's over 940 food banks across LA County being organized by the LA Regional Food Bank. You can visit your local food pantry, and we've got the link there and the website, or you can call 211 for information. LA County Parks, thank you, Park and Rec has free food programs for youth, teens, and seniors. And to learn more, you can go to the Park and Rec website. There it is. LA County stepping up to the plate. If you are a senior over the age of 60, you might be eligible for a free meal at your local county senior center. And for more information, there's the phone number. We're going to make sure that these slides with these phone numbers and websites and resources are available on my webpage so you can find them as well. WIC, which is, the Supplemental Nutrition Program for women, infants, and children, pregnant women. All WIC agencies are currently operating. That's some good news. Even government employees, some of those, the federal government employees who've been furloughed or who are working with no pay, ridiculous. You may qualify for WIC if you're pregnant or if you have a child under the age of 5. So you should apply and get WIC to help with grocery costs, even if it's only temporary until you are no longer furloughed and get your salary back. Applying for WIC is really simple. It can be done by phone, or you can apply online. Do we have a slide for that? www.startwic.org, or text apply to this number, 91997. So if you are a furloughed employee that you never applied for, or you're not currently on any kind of public benefit, if you're pregnant or if you have a baby under 5, go get you some WIC to help out in these coming days. You can find a WIC location near you. That was a lot of information. We are going to continue to push at the county and work with our partners in philanthropy, going to work with private sector, the churches. Like I said, Bishop Fisher today taken upon himself to take care of his own flock. He said something like, how can he preach when he knows people are so afraid and worried about how they're going to feed their families this week? So I tip my hat to his vision and leadership, and hope that there will be other faith leaders who are willing to step up and do the same. This was some hard information, but it's important information, particularly for me, given who I represent in the 2nd District. And so know that I will continue to do all I can to get the information you need and continue to communicate to the federal government the risk they're putting people in. Too many people who live in the 2nd District already live in food deserts. We already know food is getting more and more expensive. Here we are entering the season of family gatherings and food, right? Thanksgiving and Christmas. And people aren't comfortable or confident in knowing that the benefit that they're entitled to will be made available for them. So stay tuned. We're going to stay alert, continue to push policies that help people who need the help. And I thank you very much for joining me with Sippin' My Tea. It was an important conversation, and I'm glad you all joined. Please share so other people can have access to the information. Thank you all, and we'll see you next month.